Good evening, everybody, and welcome to tonight's webinar. We're excited to have you with us this evening. We'll be allowing a 5-minute window to enable more registrants to join. Due to our strict privacy policies, we kindly ask that any AI note takers be disabled for this session. If we can't tell that they've been turned off by 6:05 p.m. EST, we will have to remove you from the session. While you wait, please participate in the poll that should be popping up on your screen shortly. Your responses will help us better direct the information for tonight's session. Thank you for your cooperation and enjoy.
Bonjour, bonjour, bonjour. Welcome, friends. It's wonderful to have you here this evening. I'm so elated and excited for the conversation that we're about to have. I hope this all finds you well. I hope you were dancing alongside us, because I know my presenters today were. I would like to welcome to our midst Dr. Adilia Sapp and Dr. Tiffany Smith, both practitioners at the DNA Company and people who are very focused and passionate in the space of mental health and how genetics can interface with it. Welcome, ladies. It is a delight to have you here this evening or afternoon, depends on where you are. I'm calling it from California today, so it's still an afternoon, I believe, for me. Where are you guys?
I'm in the greater Seattle area, so same time zone. It's still mid-afternoon, although quite dark here, so feels a little bit like evening.
Yeah.
Yep. And I am in Las Vegas, Nevada. So we're all on the West Coast, Pacific Standard Time today.
Being
There we
fancy. And
go.
I'm curious where people are calling in from. Wherever you might be calling in from today, please do let us know. I think the furthest we've gotten it was Australia and New Zealand. I'm really looking for further reaches. My goal one day is like someone's like, I'm in the Arctic. It could happen. May not, but it could.
Happen.
And
We'll
so
get there.
one day, one day. So I'm going to very briefly allow these women to introduce themselves and how they support mental health within their practice. And as they're doing that, I really encourage, please do fill out your survey so that we know who's here today. In particular, when it comes to mental health, there's a lot of people that might be asking questions for a loved one, for themselves, or perhaps to the end of prevention. And so we really want to ensure we're serving who's here tonight and we're speaking to what you want to know. So after you've filled out the survey, please, I really encourage you to toss into the chat, here's why I'm here tonight, and this is what I'd love to learn, because we want to speak to why you showed up. Is it for yourself? Is it for a loved one? How can we best serve you? Are you a nerd? Are you so in here just because this is profoundly fascinating to you? Let us know and we'll serve that. So while we do that, Dr. Sapp, Dr. Smith, I'll allow the Canadian traffic jam of who goes first of politeness, but I wonder and I ask if you could each introduce yourselves, what sort of practice you have and how genetics has started to be folded within it, how its power is starting to shift how you're approaching people and the care that you offer them.
Yeah, absolutely. I can start. I did start at the DNA company back in its infancy, back in Mississauga when we were making supplements by hand. Not actually, don't worry. They were safe and all. But when the DNA company first started. So I started in mental health back in my internship in 2017 in Toronto. I've had a clinical focus on mental health and cognitive health since then, as well as an intersection there with genetics. And I'm currently in family practice, so I'm a family physician here in Washington, and I do have a focus on mental health. It does help a lot to know what your genes are. So unfortunately, not all my patients can get the coverage to get their genes tested. But when it comes to the naturopathic and dietary changes and implementation, in terms of where the issues are coming from, it definitely can guide the practice. And I've seen a lot of examples of that. And I'm sure Dr. Smith can speak to that further.
Yes, I am Dr. Tiffany Smith. I'm an integrative and functional psychiatric nurse practitioner. So a big mouthful there, right? But at the end of the day, my belief was that more could be done in the mental health space than just medication. So I assess, diagnose, and treat mental health conditions as that of a psychiatrist, but I am the nurse practitioner version. And I felt that more was needed to stop the revolving door of mental health, that we really needed to start getting to the root cause and treating really why we are there, why you're having those symptoms, what's really going on. So with my journey with my husband, whom decided not to utilize Western medicine for his chronic pain, which led to other conditions, it led me into functional medicine, lifestyle medicine, and integrative medicine to understand how to actually get to that root cause. And in doing that, adding the genes has just been profound because it gives a layer of understanding of who you are. In traditional psychiatry, it's okay, SSRIs, a selective serotonin reuptake inhibitor. But what if you're not creating serotonin? What if you are holding too much serotonin already? Those things aren't taken into consideration. It's just if you're sad, you get the anti-sad pill. If you're sad, if you're anxious, you get the anti-anxiety pill. And so by understanding how you work, how your body is made, now a treatment can really be personalized to you. And then with the additional functional components and testing, We get to the root cause and treat you well and help you to live a life based on you, giving you health independence. So I love partnering with clients in that way. And I'm out in Las Vegas, Nevada, like I mentioned, and licensed in the states around me as well. And I just offer overall health and wellness by utilizing the genetic component as well. I think it's the one thing that's missing in our health and wellness.
I value, I'm scanning right now who's here, and I value the wealth of information that both of you are going to bring to the conversation tonight. Because as I heard it, neither of you said baby or bathwater. You said, how are we going to work with this? And then on top of that, let's add in some genetics. So I'm really excited for this conversation. It sounds like there's quite a few practitioners / nerds in the audience. I wear that as a badge of honor. So please extend my compliments to you. So we'll allow the conversation to speak to some practitioners to get to that nerdy level, but we will still hold an honor reverence to those that are perhaps coming to the end of, I'm really struggling with anxiety, depression, whatever it is. The only option I'm hearing about is the anti-SAD pill. What are the other options? So we'll make sure we show up to our audience tonight. So I wonder if we can start off with clinical experience that either of you have that speak to, here's how someone presented to me, and here's how I leveraged both holistic integrative practices alongside genetic awareness of the person to shift how I went about treating them. Yeah, Dr. Smith, I wonder, maybe we start with you, because you shared a very powerful story when we were doing the huddle just before this, when we were kind of aligning on what do we want to talk about.
Yes, I had a client come to me that stated he felt that he had ADHD. His dad was just diagnosed with ADHD. He feels he has ADHD. He can't stay on task, can't sleep, can't focus, and has been irritable and angry and just put me on meds, you know. And oftentimes when clients come to see a mental health provider, they've tried it all, they've done it all, they're out of options, they know they're going to get put on prescription, so they're at that level. And he was there. And I said, well, wait a minute, you know, and I explained how I work and getting into the root cause of things. And we did the genetic testing. And what we found was that his genetic markers for mental health was actually all fine. His challenge was that he had issues with detoxification. It was in his liver and his gut that caused him to have presenting symptoms that looked like ADHD. And that was so profound because now he saved a lifetime of being on stimulants, starting on Adderall, then increasing the dose, and then adding medications for the side effects because you can't sleep. And now you don't have an appetite, and just all this lifetime of let's try this and swap that out. We nipped all of that in the bud by getting to the actual root cause of what's going on, optimizing nutrition, lifestyle, supporting the liver and gut to help him lead the life he wanted to lead. And we didn't have to bring in those things. They weren't required or necessary for his case. So I think that was huge. And I always tell that story because it's so profound in really getting to the root cause and how it can really help you get to living your life sooner than later.
Yeah, I love that story. Sorry, Dr. Sapp.
I love that story. Sorry, I just had to interject because it really aligns with my clinical experience as well. Just even when it comes to something like ADHD, we don't even know where it comes from, right? One of the most associated genes would be dopamine, and we could look at DRD2, we could look at other dopamine genes, we could look at COMT in terms of impulsivity and hyperactivity, but at the end of the day, it can come from a lot of different places. And I've had experience with patients who've had mold toxicity or mercury toxicity, and they've presented with new adult onset ADHD, which we were taught isn't really a thing. You're supposed to have it when you're a kid. But now for some reason, there's all these young adults that suddenly have ADHD. And then that's when you have to ask questions like, where is this coming from? Is this, you know, a dopamine deficiency, or is this an exposure? And really looking at the different areas of people's genes is very helpful in guiding that process because it's kind of like your blueprint. And then you can do further labs after but to know which labs to test, it often helps to start with a gene. So I really liked that example, and I think it's a really good one. So um, in terms of like patients that I've seen, um, in the past, I used to work a little bit more in functional genetics as like a consultant, and currently not all my patients are doing genetic testing. But just to give an example, a little bit of an anecdote, if it's not too much of a segue from the DNA company back in the days, we used to, among our staff, and we were always confidential with client information, we used to share some of our genes in the cognitive section because we thought it was interesting to compare and discuss temperament and cognitive styles, and something that section of the report, the cognitive and the mood section, can tell you and is strongly correlated with is temperament. But what you do with those specific predispositions can be the difference between having mental illness or not having mental illness, being low functioning or high functioning. And that is where the epigenetics and just the beauty of these reports comes in, because there's so much to work with. And there's also so much hope, even if you don't have the genes you wanted to. So.
I wonder, this would be where I'd love to offer an anecdote, right? In particular to the end of genes can be worked with, right? Having a gene does not mean you are going to have an outcome. Very rarely does it mean that. And so what I would offer, and this was, a consult I took maybe 5 years ago, and it completely changed the way I approach patient care in regards to genetics and explaining thereof. So in advance of our consults, we'll go over someone's genes in large part because, as Dr. Sapp has mentioned, it really tells us about a disposition of a person. And the person coming into me, from a mood and behavior perspective, to a degree, could not have been more suboptimal. They were this perfect storm of everything was suboptimal. And so I was expecting a consult that would have been really difficult, scattered attention, very anxious and or depressed, kind of not able to focus and compute nor want to, right? And I was really expecting a difficult consult because talking about genetics with someone who is struggling in that space can be difficult. And this woman comes in and she is composed, collected, focused. And when I said, here to see me today for, it was something completely irrelevant. It had absolutely nothing to do with mood and behavior. And my first thought was like, okay, maybe I got the person's genes wrong. Maybe I looked up the wrong person. And I'm waiting for that proverbial shoe to drop. And as we progressed, we addressed her concern at the very end of the consult. I said, hey, how are you feeling? You've expressed really well today. And I was really digging, let's be plain. I was digging to figure out, where's this person? Did I mix this up? And eventually what came out is that this person had been raised by a therapist, and mental health discussions within their home were very commonplace. Feelings were encouraged. And further to that, more interesting to that, how do you approach feelings? How do you ensure they don't take over your life? How do you use them as constructive things as opposed to destructive things? Was a central conversation. And so she had a lot of tools. And her comment to me, which was so interesting, she's like, I'm frustrated that I need to exercise all of those tools almost every day compared to my siblings who only maybe exercise them when, the proverbial ish has hit the fan, and, they need to use it because it's more stress that's imparting them with struggle. And so this person, this is important for people to hear. If your genes say you're not optimal, there are things that you can do in light of that to work with them. This woman happened to be serendipitously born to a therapist, right? The toolbox was given to her from birth, but it's not inevitable. These can be worked around, right? They can be supported, and knowing that directs how we go about the support, which is very interesting to me, right? As a clinician, to an extent, it fine-tunes where you need to focus.
That is such a good example. Although being born to a therapist does not always work that way. But as a personal anecdote, being born to a psychiatrist does not always work that way. However, I know a lot of other children of therapists, but that was a beautiful example. I've seen the exact same thing. Because I've done a lot of at least short genomic consults from back when I was with the DNA company and after coming back. But I've seen people who've had across the board optimal cognitive health and mood and behavior. And because of life circumstances, because of trauma, because of lifestyle, because of potentially socioeconomic factors. And this is why I talk about the biopsychosocial model. I just talk about that. It's hard to escape, right? People say, oh, but I thought you could just go to a therapist. Yeah, that's great. Oh, but I thought you just needed meds. Yeah, you might. Oh, but I thought, well, you need to address the biology, the psychology, and the social aspects, right? So anyway, so we had another person that I was working with where it was the opposite, like your story, Krista. Everything suboptimal. I was shocked when I saw, their samples, and no, there was no sample failure. Those were their genes, and they confirmed it, and they were familiar, and they grew up in a supportive environment. They should have had, just based on their genes. I expected them, and these aren't clinical genes, just so everyone understands. They're genes where we can kind of modify the outcomes. They're not directly associated with different illnesses, but there are correlations. So this person grew up in a structured environment. I thought they would have had ADHD and been an extreme risk taker, because they had fast comped, they had low dopamine, they had genes all over the place, and nothing. Perfect focus, perfectly level-headed. They happen to practice mindfulness, and have a relatively stable upbringing, and numerous other factors working in their favor. And they also worked at it. So yeah, we see that all the time.
Yeah,
So-
that's awesome. Real quick, that's where when you have this knowledge about how your genes are, and you put those lifestyle factors into play, you don't have to have the Xanax, an Ativan. You're learning how to calm the nervous system, calm the body on your own. And that's what we all want, right? But sometimes life happens and we need something now. But while you are addressing now the best way you can, even if that's with Xanax or Ativan or what have you, you're learning these other lifestyle factors. You're learning you. And these genes help you understand you so that now you can take control and it doesn't take control of you. And that's what I took away and wanted to add.
Yeah,
Mm,
absolutely.
yeah. I
And
think,
yeah.
no, go ahead. Go ahead.
No, I mean, as a personal anecdote, I remember the first day I got my genes back, and I had a bit of grief. I had a bit of shock. I was across the board, other than BDNF, suboptimal in mood and behavior. But it really helped me understand where things were coming from. I finally accepted the fact that I had higher sensitivity to my environment. I accepted the fact that, I may have some tendencies towards ADHD, but I don't have hyperactivity, and that there's ways to manage it. And it just gave me a greater understanding and acceptance of myself, and my predispositions, as well as giving me some tools to change that. Like if we have slow comp, you might want yerba mate over green tea, for example. Yeah.
We're unpacking a few more of the specifics here because we have a few practitioners, we have a few self-identified nerds. I wonder if we can start unpacking a little bit insights that we can gain from test and really scoping out the limits of the test too, because I want to be very plain to the audience. This is not a test that will diagnose a psychiatric condition. This said, it is a test that will guide how treatment can be offered and guide how therapeutic relationships can best be offered and where you want to focus in regards to calming that nervous system. So why don't we start unpacking that a little bit? So I would offer the statement, our test is spectacular on the spectrum of anxiety, depression, focus and attention, as well as general, to your point, like addictive sort of tendencies or lack thereof, right? Why don't we unpack a little bit how that might show up in clinic, how that might show up in people?
Yeah, I mean, like in terms of concrete examples for, the nerds in the audience or the people who have their reports or the people that want like, some of the specifics. The first one I thought of was 5-HTT-LPR. SSRIs tend to be a really common go-to band-aid in psychiatry and even in primary care. And not everyone responds well to them. I see them as kind of SOS emergency medicine for, really difficult life circumstances that may cause overwhelm. If someone's in like a position in life and they're drowning, that's often a place for them. And I don't know what you would say about that, Dr. Smith. I'd be interested, but one of our genes here tells us that you may not be a good responder to them. And so that was just the first concrete example that I thought of.
And I'm with you with that. I think that we have to not go medication first. If you're in distress, if the house is on fire, we need to put some water on that and we need to calm that down, because you're not going to go anywhere, do anything until the fire is out if you're really struggling emotionally and mentally. And while that is working, then we're testing, getting those results back, and then we start to add in the lifestyle and nutritional implications based on the findings. So, looking at maybe like depression, you have people that have dealt with depression for a lifetime, and all of these medications have never worked. I mean, just from a child up through adult. And when you take a genetic test and learn about MTHFR, BDNF, and how your body responds to that, that's huge. That can be the thing that stops, and now as functional medicine, we're also looking at allergens and gut health and all of these other things as well. And when you put that together, now your supplementation isn't a shot in the dark. You know exactly, okay, I have an MTHFR deficiency, which is the folate metabolism, and my BDNF, which is your brain-derived neurotrophic factor, is lower, which is the neuroplasticity, the resilience. We say your mental health resilience, for example, to shorten that. There's ways we can support and supplement that, adding some folate, adding some vitamin B12, having some omega-3 fatty acids, encouraging exercise. We always know that exercise is good for us, but oh my gosh, we don't know in all of the way our dance, we don't know all the ways that it is, and it improves our brain resilience, our mental health resilience, that BDMF. It improves your mood. And we can talk about, we even talked about some other ways exercise improves you as well. So that's where the genetics gives you just that extra secret sauce to make all of this make sense, and helps you. Now it empowers you to take control of your health because you understand where you are. There's nothing wrong with you. It's just how this world is supposed to adapt to you.
Yeah.
Good way of putting it. And I don't know if we saw the cue. We have our poll questions that we're going to go over. Dr. Kostroman.
Toss them up. Yes. All right. Thank you, powers that be. All right, so we asked our audience, firstly, are you familiar with the connection between genes and mental health? And about 68, so a majority of our audience says, somewhat familiar, with about 20% saying no, not at all. So I guess hosts, let's make sure we draw some of those connections between how genes translate into enzymes, which translate into up the chain we go. The next question that we've asked is, do you believe genetics can play a significant role in mental health conditions? And this is an interesting divide. So 42% saying absolutely, yes, they can, major role. More than half the audience, 55%, saying somewhat, but other factors are more important. And then lastly, about a 4% saying no, it's kind of all what you do. This is that nature nurture question. And so there's most of the audience is saying combination, but there's a big chunk that's kind of saying it's more nature than anything else. The last question that we have here is, which areas of mental health and genetics interest you the most? And a majority of our audience here is the personalized treatment based on genetic information, which I think beautifully we've started to speak to, and we will continue to speak to. Following in a solid second, 35%, genetic predispositions to mental health conditions. So we'll make sure we focus that on that. A small percentage are concerned about ethical and privacy concerns, and me too, moi aussi. And I think we can redirect. We've done a few webinars very specific to health privacy, specific to genetic privacy. And so maybe the powers that be can populate that there, because I think that's a really important conversation, a barrier to care for some people, reasonably so. And I think, but I don't know if that would be best served in this forum. So we'll support you through webinar links. Yeah.
You've got to keep speaking French, Krista, so you can remind us all of Emily in Paris. I'm just kidding. Had a moment there.
I love that. I love that Dr. Sapp says that as if I'm the only bilingual here in the chat, Medell. All right. So let us then kind of come back again to that unpacking of, let's draw the connection between genes and either a full outright mental health condition or things that can kind of be masking as a mental health condition. Because I think I very much personally empathize and identify with, sometimes I get rolling anxiety, but it's not because of my genes. It's because of I do not detox. My body got an IOU for those sorts of things. And so I can tell when my body is dirty, i.e. a little overwhelmed by the physical environment, because I start to get anxious. And it took me a long time to make that connection. For a long time, I thought I was anxious. And actually it's, no, just my body's dirty and needs to be cleaned up a little bit.
And yeah, that's such a good example. And anxiety would be a good one to start with, because it pretty much relates to all of the genes in the cognitive section and a few other sections. So if you start from the top, if you start with COMT, which is a gene that creates an enzyme which helps break down catecholamines like dopamine and norepinephrine and serotonin, then slow COMT is more correlated with anxiety than fast COMT. If you just look at the genes in isolation, that is. And then if you look at ADRA2B, that one affects your noradrenaline response and your fear response and can make you more prone to PTSD, as can COMT. So the suboptimal variations would make you more prone to anxiety as well. So if you go through all the genes, they kind of affect anxiety in different ways. And hence the point that looking at your genes first can really guide the direction of your treatment plan. Because if it's more related to, I'm overwhelmed by toxins right now, like I am like surrounded by pollutants and I've just had a mold exposure and I just like ate a bunch of sushi and it's all colliding all at once and I have this anxiety, you may move more towards some milk thistle or glutathione or sauna or whatever your strategy is versus get a prescription for Prozac. So it really helps to know kind of where it's coming from. Anxiety can also be related to the cardiovascular section even of the report. That one is a bit of a stretch, but if you're, having an acute cardiovascular issue and you have suboptimal genes there, it could be related. If you have poor methylation and you're not metabolizing folate and you have suboptimal MTHFR and 3 other genes in that area, maybe you need some B vitamins. Maybe you need some anti-inflammatory agents through diet and supplements. So those are just a couple of examples. And Dr. Smith, you can just roll with this one because anxiety can come from so many different places.
Correct, which is why you don't want to just give out these medications just haphazardly. You really want to get to the root cause. I like to empower in what I do. And so by me having this understanding, then I can empower people on the education of how to eat if you have anxiety and how helping you get in touch with you. I do resiliency training so you can know how to build you and be resilient to life and what's happening. And so Yes. So this is my empowerment tool that helps me to build and build and empower the community, the population, to be the best that they can be and not have to worry about being addicted to benzodiazepines, not having to worry about a lifestyle on ... You know that if you're on these medications, it is absolutely because it's necessary and not just because it's just a Band-Aid or something that's an easy throw at you. And that's what the DNA tests do for me, is to take me through the journey you just went through, Dr. Sapp, to get to the treatment plan for you. Your lifestyle plan is what I call it. How you're sleeping, who you're with, what's work like, what are your relationships, what are you eating, how are things, what triggers you, everything down to where you breastfed or bottle fed. All of that comes into play and giving you that full treatment plan. That's the power of the genetic testing, and then adding the functional medicine aspect as well. It goes together.
Yeah. One of my, while I by and large don't do pediatric support, mine tend to be more adult clients. One of my favorite groups to work with, just more from a passion heart place, is parents who have swabbed their children. And the reason I say that is it helps them understand how their child is formed up in the world and helps them embed those lifestyle things in from an early age. So for example, if we know you have poor BDNF and are a little bit more subject or at risk for kind of internalizing trauma or being hypersensitive and having that racket, knowing that can change the way you approach your parenting and supporting of that child compared to, right? Like if you don't detox well, you know, you need to focus more on keeping that clean environment. And I think, you know, I see often a lot of these consults that I do are not because the child came to me, but because I worked with the parent, and then the parent is like, I want to know how you work so I can guard and support all of this and teach my child when you're stressed, these are healthy, good ways that you can respond because you're going to be weakest in this way. Yeah.
Yes, I agree. I
love
treat parents because the kids would break my heart and burn me out. So I believe in treating the parents to treat the families.
Yeah, yeah. And I stayed away from pediatrics until recently, but because the rate of adolescent mental health in the US has just skyrocketed, and I don't know what the statistic you last saw, Dr. Smith, was. I saw at one point recently that about 1 in 2 US teens
Yes.
may have a mental health condition. So I've started slowly transitioning into that population as well, just because there's so much need for it and so much demand. And um, that, I mean, it does relate to this conversation of like partially epigenetics and changes that are happening. And the fact that anxiety, depression, ADHD is not just a disorder of the mind. You know, I think we've moved beyond that. It's also a physiological change that occurs in the brain and the body. So just recognizing that connection between the brain and the body and the nervous system that connects it is where looking at these genes and seeing how they affect mental health comes in. So. Yeah, and that is ultimately what got me into naturopathic medicine. I don't know about you, Krista, but at one point I wanted to be a psychiatrist, and then I ended up studying psychology. And then I got really tired of just talking about psychology and the brain when I knew that part of it was related to the body. So basically, your diet, your supplements, your lifestyle, they all have an effect on mental health conditions, and every little bit counts, essentially.
Yes.
Yeah. Yeah.
I say that mental health is everything, and everything is mental health because it's all connected right back to our mental health and well-being.
Yeah. Yeah.
Yeah.
And I think it's so beautiful now that now that we've kind of divorced ourselves from the idea that mental health sits just within the brain, right? Now that we acknowledge there's an element of socialization and how the world engages with us. There's an element of the toxicity within the world. And there's a huge element of diet and lifestyle, right? I think one of my more favored studies around how important something can be was It was a study within a psychiatric inpatient facility. So these are people who their conditions have put them in a space where it's best for them to be tended within a facility, right? And the intervention they offered here was simply encouraging, enabling, and empowering people, these patients, to get 8 hours of sleep. So tools and tactics, et cetera, compared to not. I think they got, material and something else. I forget what the control was. But simply by engaging in good sleep practices, right? The people were able to decrease the severity of the presenting condition. It did not get rid of it. Let's be plain, right? Solutions are going to be multifactorial. It's not going to be if you sleep 8 hours, you're going to get rid of a full-blown psychiatric condition, but they were able to reduce reliance on emergent medications. So kind of medications that are put when a person is unable to control themselves and at risk to themselves, right? And they were also able to get further and move further within other therapies and other modalities because their body was in a space where they were able to work with it. And I've heard this both from Tiffany, Adilia, both of you. You said medications have a place, but it's usually to the end of putting out that fire so that you can start the true work, right? So they're not bad, but they're also not the fix often.
I would agree. Yeah. Yeah. And I see that a lot where just like little tweaks like that, like for example, I've had young patients who don't realize that you need to eat protein to produce amino acids to help, your dopamine production, or to get amino acids to help your dopamine production, to help your ADD symptoms and to help your mood and stuff. And so protein, I don't know if you would agree, Dr. Smith, is like a pretty big part of an anxiety diet, like increasing protein, understanding that it's important, especially a lot of young women I find end up not eating enough protein. And things like vitamin D, it's associated with ADHD, it's associated with anxiety and depression. And there's a gene, that'll tell you if you're more likely to have vitamin D deficiency. If you live in the Pacific Northwest, you probably do. Maybe 50-50, but if you're not taking it, but it's a good chance. And so the genes can help you with those physical factors, which can in the end be the difference, right, between being well and not being well. So yeah.
And being matched with a really good practitioner who will hear you and then is able to consider the different areas. So, for example, just going back to the concept of protein, I was plant-based for a long time, about 25 years. So I got referred a lot of people who either were or wanted to become. And I started to see, especially within that group, a high prevalence of depression, anxiety, and simply listening to the diet. By and large, it was a deficiency of protein, right? So once we simply shifted that, that's not to say that diet is bad. It's more to say when a diet is not properly implemented, in particular for the person before you, everyone needs a little bit of a different diet. It can and it can create situations where you think you are depressed or anxious, as that being the root cause, as opposed
And
to
also, right. And to your point, your genes would also play a role there. Like, if you have suboptimal methylation across the board and you're not methylating efficiently, that would increase the chances that a vegetarian or vegan diet might not be right for you. There's some people that it could work for, but your genes are an important factor, If you're half Eastern European and you have bad methylation across the board, maybe genetically that wouldn't be optimal. So, it helps to know where you come from. So, yeah.
Yeah. I'm seeing quite a few. I want to acknowledge there's quite a few questions in the chat, either privately or more publicly, where people are saying, hey, I'd love to work with one of the practitioners, Dr. Smith in particular, getting a shout out from actually someone I know, and I think you two would be a really good connection, Yvonne. If you are interested in working with any of the women that you're seeing before you or separately, someone at the DNA company, just shoot us a quick email. We'll make sure we connect you properly. We want to make sure you're enabled to the best care, whatever and however that looks like for you. And yeah, no, I think just the breadth and the depth and the personalization of medicine can be so important, and the game-changing factor, right? The more we know, the more we're able to empower you with information. the better the end outcomes are going to be. Yeah. I want to soon transition into questions because I'm seeing a few pop up. I encourage our audience, if you do have questions, make sure they are going into the Q&A section because our chat window moves a little bit and so we can't necessarily capture them there. But before we do, any thoughts as to if we have someone on the webinar this evening who either they or someone they know is struggling, right? What are best steps to kind of get them activated on that way of let's engage you with an appropriate practitioner, right? Because I can imagine what we've just said tonight is mental health can be caused by absolutely anything and their best friend, right?
Yeah.
So I can appreciate some people feeling like, oh shoot, I'd better figure out myself if it's a detox, if it's a this, if it's a that. What are your thoughts? Let's make this a little bit more simple. What are your thoughts? Like, how do you like people to approach you? And also, like, if you don't think the care is appropriate, like, how do people work their way into the system, be it your system or a separate system, to seeking?
I start
Yeah.
with a discovery call, just so that we can kind of talk it out a little bit and make sure that before you make any investments or what have you, that you're on the right path, you know, that we can be a good fit. The relationship with the provider, the practitioner, is extremely important to you having good results. And it can be difficult finding that partnership. Also, if the provider partners with the wrong individual, it can be extremely draining and affect the care that they give to everyone else in their practice. So having proper partnership and taking just a moment to talk with each other, make sure you're on the same page, you have the same goals, you're able to help the client trusts and likes you is so important. So I offer a 15-minute discovery call to start the conversation and then go from there.
Mm-hmm.
Yeah, that's a really good point about the practitioner and the patient fit. And it's also it's a two-way relationship, of course. It's not just the doctor telling you what to do. It's yeah, there is that feedback loop there. And I often emphasize like just going back to the biopsychosocial. If someone has done their genetic report, booking a consult with someone who has an understanding on that, as well as someone who's, working as a health consultant or functional practitioner, like myself or Dr. Smith, would be one place to start. And then also seeking counseling for the psychological and life stressor aspect, just to talk things through. Sometimes I have patients that come in and I kind of have to explain to them how, naturopathic medicine works, that I'm not quite a therapist. So we're not necessarily going to delve into their relationship issues. I'm happy to discuss whatever you want, but that would be better suited for a counselor. So I think having a functional doctor or a naturopathic doctor or someone in that realm with a focus on mental health on the one hand, and then having a talk therapist on the other is often a good place to start, as well as social community around. If you can, all the touch points you can make a difference. So
Community is a game
I love
changer.
that. When I was thinking about, okay, where do you start if it's just you and you can't get out of the bed, right? I love that how we have our social media and social networks where if you're in a very low place, you can start with just getting on some forums and communities where you don't have to be in person, but you can start to release some of the emotions that you hold. And then you slowly start to engage as you feel suited. So that way you don't have to stay isolated. You know you need to do something, but I can't get out of bed. I can't move. That's a way to start, especially if you lack community. Loneliness is a big thing that is going on right now. And that's one way to just kind of move the needle, getting in communities where other people are feeling the same and you can relate with, and you can learn strategies, and you slowly start to build confidence, and you slowly start to improve and engage and start to get inch by inch, it's a cinch back into your life. Then you're going places in person and you're, it's building you. So just know that wherever you are, if you just take a little step one step at a time. You'll get to where you want to be. And then those of you that are here for someone else, giving them grace, letting them know, giving them permission to know it's okay to feel what you feel, extending grace to them so that they can work their way through what they're going through. And then you start to put the fires out, and then start to bring in all of the support and learning and education of yourself so that now you're living in your divine destiny.
I love that. Yeah, yeah. And Dr. Smith, on that note, I think also just that understanding that it's really a journey, right?
It's a
You
journey.
know, we haven't exactly been
Totally agree.
trained that way. A lot of us, growing up, like, the medical system didn't really train us to believe that. It was like, oh, you have a problem, let's fix it, and then it'll be
Exactly.
gone. But, it is a journey, and we just want to slowly take steps to slowly move in the right direction. And on that note, it reminded me of just a therapeutic technique that I use a lot, and I often give handouts on it. It's called behavioral activation. And it's so helpful in depression. And it's basically just the concept of every day you pick something that you enjoy or something that you've been putting off. If you're really down and out and you're depressed, you're anxious, you're overwhelmed, you just pick one thing each day and you do that thing. It's either something that brings you joy or it's something you've been putting off where you'll have a sense of fulfillment after. That could be even just making a call to a practitioner, for example, or a counselor, or calling a friend. And then you rate your state or your level of stress before you do that activity, and then you rate it after. So that would be with a handout. But just activating yourself to act, to take that one step, and then the positive emotions tend to flow. So yeah, that's one strategy I use as a starting point.
Yeah, I think to an extent that starts to bring you out of a head space of focused exclusively on how not great you feel, or separately just how quickly the mind's moving, like doing something outside of your head.
Mm-hmm.
Relationship can be so healing, right? That first step of talk to someone online, or that first step of, okay, cool, I'm finally going to take out the trash, even though that's what I've been really struggling with. That action can be the catalyst that kind of starts it, right? That first, you start a marathon by taking a step, if you're so inclined. Crazy people. There's some crazy folk on here who do marathons.
Dr. Kostroman prefers yoga. That's okay. We're good with all kinds.
Yeah. And again, I would encourage people, before we shift into the Q&A, sometimes you'll approach a practitioner and they're like, I don't have space in my practice, or I'm not appropriate for you. I really encourage you to then say, okay, cool, can you think of someone who else is? Because I won't offer a blanket statement of all practitioners care, but by and large, most of us come to this space because we want to help people. And if we are either not the appropriate person because it's a skill set that we don't possess, or separate to that, our practice is full, whatever that might look like, 99% of the time will happily refer you. And I think those steps eventually get you to that person, because I know sometimes it's hard to find someone that resonates with you and to start this relational journey, this work. So make sure you don't give up and ask along the way, because most of the time someone's going to be like, of course, I'd love to help you by referring, or by this or by that, or helping you take out the trash, whatever that looks like. Yeah.
Absolutely. And then when it comes to talk therapy, I often have a bit of a rule of thumb of 3 practitioners. Some people compare it nowadays to online dating
I was going to
because
say,
it
I was
takes a
thinking the
couple
same.
tries sometimes.
Maybe on the first date.
Yeah. And then I also have a bit of a rule of thumb, and I'm not the only person there are other people in personal development communities that are kind of like, after 3 sessions, if you're not getting worse, if you're talking to someone who's minimally competent that you feel comfortable with, there's evidence that should be helpful for you. So some people get really caught up with picking the perfect talk therapist, for example. So that was just a little tip there. You can try 3 different people. You can try 3 sessions each person, and then you'll usually have a sense of whether you're moving in a good direction with someone. So
I like that. Not expecting perfect on the first date. It's
Mhm. Yeah.
All right, so let's move into the questions here, if that makes sense to everyone. So our first question, just have a first initial, so it's from a K. K is a nerd, love it. Love it. And so a very general question of, can we speak to epigenetics and how they kind of can influence or perhaps overcome genetic predisposition? So I think at least through anecdotes, we've established that genes are not fatal. And so I wonder, I have a few thoughts here, but before I offer my thoughts, Doctors Smith or Sapp, do you have any thoughts around epigenetics and how they can influence mental health?
I think Dr. Sapp would be good on this one.
Yeah.
Oh, okay. Well, thank you. I appreciate your confidence in me. So yeah, typically when we're talking about epigenetics, we're talking about the presentation based on someone's genome. We're talking about the presentation, the phenotype versus the genotype, other than the separate conversation of genetic mutations. So most of the genes in this report, we can change the outcomes if we find them early enough, if we're making changes and modify the expression. An example, like a really quick example, would be the COMT gene that encodes for COMT. There are specific micronutrients that can speed up or slow down COMT. And the first one that came to mind earlier was just yerba mate. Can speed up COMT, and green tea can slow down COMT. So if you had fast COMT or slow COMT, that's one factor. Another factor would be quercetin. It can slow down COMT. So there are things that can turn on and off, so to speak, the genetics or the genetic signals that come afterwards. BDNF, for example, that's another one we love to talk about. Infrared sauna can change the expression of that gene. It can help you at least produce more BDNF, as can sunlight or cardiovascular exercise. There's even some supplements like coffee fruit extract. There's countless examples pretty much for all of the genes that we have in this report of how we can kind of modify the expression or the epigenetics of those genes. So none of these genes are fatalistic in the sense that one gene will lead to one condition. That's very much the minority of genes overall that have been studied. And in most cases, your environment plays a big role in whether the genes will turn on or off, so to speak.
Yeah. And in more from a localized sense. So we at the clinic level are incorporating a bit more epigenetic testing, and none of this testing will say, based on this gene, it is turned on or off. We don't have the technology or the power to do that right now. So if anyone tells you your COMT is on or off, they're lying right at the current
Which is why I added "so to speak" in the sense
Yeah.
that COMT affects the enzyme, which affects the expression.
Yeah, but what we're getting really good at, we being the clinical science, what we're getting really good at, especially based on the beautiful virtue of computers, is we're able to analyze patterns atop DNA, and the patterns atop DNA can really speak to, are you constantly experiencing stress? Is your diet poor? Is this organ system, is your cardiovascular liver system taxed, right? And it does this by analyzing different methylation markers, or that epigenetic layer. Okay, so it won't give you exact information, but it gives you very strong general trends within the body. And the question I get frequently asked is, like, how long does it take for this sort of patterning to change, right? The evidence within the body, how the genes are expressing themselves differently. And oftentimes it is over the course of months. Why do I say this? If you're engaging in a therapy, in a lifestyle, in a diet, it's not per se going to work overnight, because you have to change that patterning, that epigenetic patterning. So while yes, it's important, the short-term wins, that small thing, that small hit of dopamine because you took out the garbage, very important. Remember that coming out, a lot of these conditions will require kind of that consistent investment in diet, lifestyle to change your epigenetics, to change the stress and the expression of your DNA. Okay.
Yeah, that's a really good distinction. And yeah, I've used some of that testing as well, with like markers like the deneen pace, and yeah, it's really interesting.
Yeah, that's all offered through our DNA aging collection of testing for those that are interested. Again, it's not going to tell you you do or do not have this condition, this gene is on or off. It just peers into the body. How is your DNA being stressed? And therefore, where might you want to focus some of your energies and efforts? Yeah.
And your
Okay.
cellular age, is that part of it?
Yes.
Yes. Okay. Yeah. Nice.
And so what Dr. Sapp just mentioned, cellular age, really looking at, over the course of a calendar year, so that 365 days, does your body think it's aged a year? Does it think it's aged less, so it's aging slowly, or is it aging quickly, right? And oftentimes with mental health conditions, that tends to go a little bit quicker because there's that stress and strain on the body, right? There's a physical consequence of it. Okay. The next question is coming in from Natalie, and doctors, I would remind you, we're not going to answer specifics here, but I just want to acknowledge the question. And Natalie, I really encourage you, shoot us privately your email. We'll get in touch so that you have more specific support. But she's saying, I want to make sure, she's trying to figure out how to support her daughter's mind to having peace, because she has been diagnosed with autism, ADHD, and generalized anxiety. And having received some medical treatment, namely some vaccines, she finds that now some of the presentations of these pre-existing conditions are now worsening. She's seeing new developments within these conditions, whether that's causative or just, serendipitous along the natural course of that condition. It's an interesting question. She says she has had her genes tested, and she's really curious what are the next steps as to approaching care, and namely how care could be offered, right? And so again, Natalie, reach out to us. We'll engage you in our systems if it's specific to us. But if someone kind of, again, with this sort of presentation, doctors presented to you, what would be some of your first considerations or thoughts, or how you would conduct that kind of, let me think about a care and support for this person?
Yeah. I mean, in that case, I would say, because it's both mental health and cognitive related, I think first about their detox pathways and their methylation pathways, and what kinds of B vitamins they're taking. And I think that in this kind of case, it definitely wouldn't be um, a straight medical doctor or a straight ND without a specialization or focus in mental health. I think a functional doctor who's able to look at the genes would be most appropriate, because there's a lot of different physiological systems that would be affected in a case like this, and a lot of different parts of the body that you may need to work with. So I think you're in the right place, essentially, and you can definitely reach out to us.
For me, from the functional perspective, I would do an oats test, an organic acid test, which would give me all of that overall broadness in addition to the DNA testing. And together we'd be able to really pinpoint and kind of get some targets and prioritization into where to start first and what's causing, where are the flames in this body? And then start to prioritize and bring that down. Also, probably looking more closely into the gut health as well. So we'll be able to target environment and to target detox, to target all of the precursors to your neurotransmitters, and then having genetics tells me what your body is and isn't doing, and then we can pull that together and come up with a treatment plan just for you.
Yeah. No, I love that, because I think that spoke to the journey. It's not going to be one visit.
Yeah.
No.
There's not going to be one visit, and it will be, a wise directed plan based on the person that shows up, right?
Correct.
Yeah. All right. So Sharon, it sounds like Sharon is a practitioner. She works with clients who are experiencing ASIA syndrome. primarily after implant surgery, such as a hernia mesh. I'm not familiar. I need to disclose right off the top, Dr. Sapp or Dr. Smith, of ASIA syndrome. I imagine it's a post-surgical. Maybe if someone wants to just ready themselves with that. How can we? Oh, you know what? I apologize. This is a webinar. This is a separate ask. I'm not avoiding the question. But, Sharon, what we'll do, we'll reach out to you specifically, given this is more a how do we have further conversations? I apologize. I should have screened this question. But Sharon, if you want to shoot us your email privately, we can speak to and engage with you on this one. All right. Okay. So Mary is asking a question for a loved one. So she's obviously done her DNA 360. Okay, and so I'll list off a little bit of that. She does not have a great DRD2 or dopamine receptor presentation. She has really quick dopamine clearance. She's air quote the drama queen. She has a drama queen gene. I'm not entirely sure which one that is, but poor serotonin, poor detox. Like, sounds like she's suboptimal in several different areas. And so, okay, and this person is saying, it sounds like this person is on psychiatric drugs, and those did not work out very well. And so they're asking around, what are thoughts for next steps? And I appreciate, indirectly we've answered this, but I'd love to hear it just again, specific to Mary, how we can go about supporting someone who it sounds like is kind of several areas of suboptimalities, and the band-aid of psychiatric drugs so far is not working.
Wow, where do you begin? It's so many things I'm thinking, wow, okay, I love this. You know, starting with just the adaptogens to calm the nervous system. I'm thinking nutritionally first comes to mind, and then lifestyle. And as you go through this, so increasing, for example, the tryptophan, like turkey and nuts, to help boost the serotonin levels, having magnesium to calm the body. You need that folate and B12 and omega-3s, exercise, just lifestyle wise, it's what comes to mind to me. I'm wondering how you living. What's day to day for you, and how we can bring in these other things to help supplement you. And then I'm thinking, probably when we see the DNA, we'll see how the meds and the pharmacogenomics, how the meds aren't best paired, and can find what actually would work best in the situation to keep the fire calm while we bring in all of the natural lifestyle and nutritional supplementation.
Yeah. I'd also be curious about like a psychology or like the psychiatric assessment in terms of the full symptom picture, and then relating the kind of prior diagnosis to the genes. Just because from the description, I could have gone in a few different directions. It sounded like nervous system regulation may be part of it, like something like neurofeedback. And then emotional regulation, minerals like lithium orotate, and calming herbs and minerals, you know. But I'd also be curious what the diagnosis was. And again, I think like a multi-prong approach would be helpful, like talk therapy and functional medicine, hopefully with a genetic component.
She also asked another question that I hear somewhat frequently, and I want to offer an answer. And doctors, I really hope that you can hold me honest in this answer. So please, if you have better access to research than I do, please help me out. She asked a question of, environmental stresses can definitely lead up to mental health conditions. Do those environmental stresses include 5G? Okay. And so from my understanding of science to date, studies of 5 kind of electronic emission on cells, and I'm talking an individual cell, we're talking Petri level dish sort of studies, have been shown to be disruptive. What we do not have evidence for any which way is, does that actually impact the body as a larger organism, i.e. does 5G impact body? To date, to my awareness, there is no evidence, because remember, at the cellular level, that does not mean that impacts the entire body as a whole, because the body is so beautifully resilient. There's many different mechanisms that can support that. And so at present, there's no evidence that 5G creates depression or any other sort of condition that we're aware of outside of a petri dish, right? And again, in the petri dish level, it disrupts a little bit of the electrochemistry, but not to the end where it kills the cell or the cell is no longer functional. It just, in a small way, will disrupt some of the electrochemistry. I want to be very specific around that. So to date, no evidence of that. And plainly, I think if there's a struggle with mental health conditions, addressing different things that we do have evidence that can support how we plan becomes all the more important, because even the answer may be yes, but I would offer things that we've talked about tonight. They can be a little bit more pointed and directed towards how you go about supporting yourself. And if you're in the midst of anxiety, depression, whatever that condition might be, right? Those are a little
Yeah.
bit. Is that a fair, did I misquote any science there? Is there an update that I wasn't aware of? I think by and large the jury's out, but we don't suspect it at present.
Yeah, I would agree with you. I mean, I'm not aware of any research linked to mental health conditions specifically, or at least I'm not. I think that it is possible that it's a factor, but that you would be likely better off targeting other factors, like Dr. Kosterman said, because there's a lot of factors. And if we can just modify a few, we often get past the tipping point where someone gets better. So it's just a matter of incrementally changing factors that we can modify. That one is harder to work with, and it may be a minor factor, if anything. I have anecdotally heard of cases where people had sensitivities, but I don't know if there's any science yet. So essentially, there's a lot of other factors we could work with for that person. So, yeah.
And I concur.
All right. Carrie has tossed into a chat a bit of a description of herself insofar as she says she's missing some genes for vitamin C and detox. So not missing, I guess, just suboptimal genes. And then other testing has really said that she has chronic sympathetic nervous system issues. So probably an overactivation of the sympathetic nervous system. As well as some heavy metal toxicity. And she's saying she's taken first steps. One of the steps she's taken, it sounds like she went to a holistic dentist and had some amalgams removed. She's already kind of doing, from a diet and lifestyle perspective, from her perspective, everything that's great for her. So gluten-free, organic, etc. And I think she's questioning, or at least asking around, like, what are possible next steps? And I'd love either of you to address this, really, in the idea of bringing in a third-party perspective, how a clinician can be so powerful in a case where I've kind of tried everything, but I'm not sure where to go next.
Yeah,
Well, no,
I guess. Oh, go on, Dr. Smith. Yeah.
well, I didn't really hear the clearing of the heavy metals.
Yeah,
And
that's what I
so,
would.
yeah, so we're
Yeah.
still stuck there. That's the fire, is the
Mhm.
heavy metals. And so we need to clear that appropriately with some chelation agents or what have you. Clearing those heavy metals is the thing that's still to be done.
Yeah, that's exactly where I was going to go with that. If you're working with a practitioner, that would be really important, because heavy metal detox is not something you want to play around with. It's a very delicate art, essentially. You don't want to go too fast, but you don't want to ignore the issue either. So you may need to pace yourself and work with a practitioner in that process. But if you haven't work through the process of taking a chelating agent like TMSA, for example, and I'm not saying just that one, that would be the first place to start.
Yeah, we do have a certified functional genomic practitioner within the DNA clinic that does do support to this end. And so either be it a program or maybe a consult to explore what options there are, because I think, to Dr. Sapp's point, it's not going to be just one thing. There's several options, and you want to pick what is most appropriate to your life, because they'll all require differing degrees of commitment, and yeah, it's that one will definitely be a journey.
And then while you're, in that process, I would say anything that helps to regulate your nervous system, whether it's neurofeedback, which I love, or even Qigong, which I also love, or acupuncture, or yoga, or tapping, EFT tapping. There's so many different things out there and so many different techniques. And depending on your budget, there's a lot that are free as well. So, I love the app, the tapping solution. There is some research, there's some good research actually on tapping, a small body, but nonetheless, anecdotally, my patients have found it very helpful as well. Neurofeedback, there's lots of research on that. Even talk therapy, typically lowers your cortisol a little bit. Like there's a lot. I would work on other techniques day to day to lower your stress and nervous system activation. So yeah, it's very individual, right?
Yeah. All right. Our last question for the evening is from D. I believe that's how you say it, D. They're asking, they're saying there's a collection of health problems they want help with, asking if we are able to support a 12-year-old or an adult, and the answer is yes, the full age spectrum. What maybe I'd love to have the conversation on between Dr. Sapp, Dr. Smith before we exit this is, 12 is this very interesting age as to, do they come in alone or do we have parents? And so I wonder if we explore the conversation of how you kind of decide, am I going to be working directly and exclusively with this patient? Is it a combination effort, or is it always going to be in tandem? Because I think with sadness in my heart, to Dr. Sapp's point, to Adilia's point, some of these issues are coming lower and lower. And if the statistic is 1 in 2, right, I would imagine there's a large group of parents on this that are saying, my baby too, how do I go about supporting them? Right. And so we want to ready you for the headspace of, do you do this, in appointment with them? Are you a champion of theirs? How do you go about appreciating where the child is at that point in time, whether, how you go about supporting their care?
Yeah. Recently, I've actually found that because, resilience is often something that we're working with in the teenage population, that people are actually coming in with their parents later and later. So I've actually seen the opposite. But typically, I start with the parents. And then if I suspect something like drug use or alcohol use or certain kinds of sexual behaviors that could increase risks, I will ask the parents to step out for those sensitive conversations. Most of the time for adolescents, though, I end up talking to the parents. I don't know about you, Dr. Smith, or talking with both.
Yes, I limit this age range,
Mhm.
but I would start with with the parent first in the times that I've had to consult the kids, and then have a separate conversation with the kids if they felt comfortable. So for me, the answer would be, it depends.
Mhm.
It depends on, a 12-year-old can have a different level of maturity and sophistication about where they are and what's going on. So, and then the relationship within the household and the culture within the household. Those would be the things that I would first talk about. But in generally speaking, I would have the conversation with the parent first, then discuss the comfort level of the child and talk with the child about what's comfortable for them, and then go from there.
I love that. So really the answer to tonight's entire webinar is, there's a lot of factors. It depends.
We like to treat individuals, not algorithms, right?
That's right.
Oh, look at you tossing. So ladies,
Yeah.
I want to just offer my incredible gratitude for you coming this evening. It's always a treat for me to get to present and to speak with you, plainly because I get to learn something every time that we chat. And I thank our audience as well. We're talking about some things that really have only come into medicine as real conversations maybe in the past 5-10 years. So snaps, kudos, incredible gratitude to you as well for jumping into these conversations, in particular in the more sadly bleeding edge way of, it's not just about the brain, it's many different factors. So huge kudos to you. We have the best audiences out there. We have the best questions, and we're so grateful to you ladies, to everyone out there. And so I think it's time we say adieu, au revoir, and perhaps we dance out, because that's how we support mental health. Yeah.
And
Au
thank
revoir.
you so much, Dr. Kostroman. I love speaking with you, Dr. Smith, and I'm so grateful for the audience and the DNA company and that we get to work in this space.
That's right. And see, we are all helping our mental health with gratitude. So everyone, thank you. Thank you for joining. Thank you for having me. And I wish everyone the best mental health, and just dance out. The world is yours. It's your oyster. You can have it. Whatever you think and believe, it's yours.
Love it.
Au revoir, mes amis.